Hey everyone, this is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 14 of my multi-part video series, providing a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to open up talking about lymphatic drainage of the breast. Lymphatic drainage of the breast significance lies in its pivotal role in the metastasis of cancer cells. A majority of lymph, exceeding 75%, particularly from the lateral breast quadrants, is directed towards the axillary lymph nodes, primarily the anterior pectoral nodes, initially. The residual lymph, predominantly from the medial breast quadrants, flows towards the peristernal lymph nodes or may divert towards the contralateral breast. Moving on. Next, I'd like to talk about what a mastectomy is. Radical mastectomy, or radical mastectomy, an extensive surgical procedure, entails the excision of the breast, pectoral muscles, adipose tissue, fascia, and as many axillary and pectoral lymph nodes as feasible. During a radical mastectomy, there is a risk of damaging the long thoracic nerve during the ligation of the lateral thoracic artery. Several weeks post-surgery, patients may exhibit symptoms such as a winged scapula and diminished abduction strength of the arm beyond 90 degrees due to paralysis of the serratus anterior muscle. Furthermore, the intercostobrachial nerve may sustain injury during mastectomy, resulting in sensory impairment along the inner aspect of the arm. Moving on, let's next talk about breast infection. Breast infection is also known as mastitis, which is characterized by an infection of the breast tissue, which commonly manifests during the breastfeeding period, which typically occurs between 1 to 3 months following childbirth. Symptoms of mastitis include breast pain, swelling, redness, and elevated temperature. The infection arises when bacteria, frequently originating from the baby's oral cavity, infiltrate a milk duct through a fissure in the nipple. Importantly, mastitis can develop in women who have recently given birth, as well as in women post-menopause. Let's go ahead and move on. Let's look at some questions. Which of the following best describes the lymphatic drainage pattern of the breast? Pretty first order question. All right, I think I gave you guys enough time here, so let's go ahead and move on. Oh, if you need to pause the video, I guess it's too late, but please just pause the video when I say it's time to move on when watching these things. But the blurb states that the majority of lymph, exceeding 75%, particularly from the lateral breast quadrants, drains towards the axillary lymph node, primarily to the anterior pectoral nodes initially. This accurately describes the typical lymphatic drainage pattern of the breast. Therefore, the correct answer is D. Lymph from the lateral breast quadrants mainly drain to the axillary lymph nodes, initially to the anterior/pectoral nodes. Let's go ahead and see why the other answer choices are incorrect. Lymph from the medial breast quadrants predominantly drain to the axillary lymph node. This statement is incorrect. The blurb specifies that lymph from the lateral breast quadrants predominantly drains to the axillary lymph nodes. Lymph from the lateral breast quadrants primarily drains to the peristernal lymph nodes. This statement is incorrect. The blurb indicates that lymph from the lateral breast quadrants primarily drains to the axillary lymph nodes, not the peristernal lymph nodes. The majority of lymph, exceeding 75% from the breast, drains to the peristernal lymph nodes. This statement is incorrect. The blurb states that the majority of lymph from the breast drains to the axillary lymph nodes, not the peristernal lymph nodes. The residual lymph from the medial breast quadrants drains primarily to the opposite breast. This statement is incorrect. The blurb mentions that residual lymph from the medial breast quadrants flow towards the peristernal lymph nodes or may divert towards the contralateral breast, but it does not state that it primarily drains to the opposite breast. Let's go ahead and move on to the next question. Which nerve is at risk of damage during radical mastectomy, leading to symptoms such as a wing scapula and weakness and abduction of the arm above 90 degrees? I'm going to give a small hint here. This nerve also innervates the muscle known as the serratus anterior. Alright, since it's a pretty first order question, I think I'm going to just go ahead and move on. So if you need more time, please feel free to pause the video. Otherwise, moving on now. During a radical mastectomy, the long thoracic nerve is at risk of damage, particularly during the ligation of the lateral thoracic artery. Injury to this nerve can result in symptoms such as a wing scapula and weakness in the abduction of the arm above 90 degrees due to paralysis of the serratus anterior muscle. Therefore, the correct answer is C, long thoracic nerve. Let's go ahead and see why the other answer choices are incorrect. Radial nerve. The radial nerve innervates muscles of the forearm and hand and is not typically at risk during radical mastectomy. Ulnar nerve. The ulnar nerve innervates muscles of the forearm and hand and is not typically at risk during radical mastectomy. Median nerve. The median nerve innervates muscles of the forearm and hand and is not typically at risk during radical mastectomy. Axillary nerve. The axillary nerve innervates the deltoid and teres minor muscles and is not typically at risk during radical mastectomy. Let's go ahead and move on to the next problem. Which of the following accurately describes the etiology and manifestation of mastitis? Alright, since it's a pretty first order question, I'm just going to go ahead and move on now. If you need more time, please feel free to pause the video. Otherwise, moving on now. Mastitis is primarily caused by bacterial infection commonly originating from the baby's oral cavity, infiltrating a milk duct through a fissure in the nipple. This leads to symptoms such as breast pain, swelling, redness, and elevated temperature. Therefore, the correct answer is C. The infection in mastitis arises from bacteria entering the milk duct through a nipple fissure. Let's go ahead and see why the other answer choices are incorrect. Mastitis is primarily caused by a viral infection. This statement is incorrect. Mastitis is primarily caused by bacterial infection, not viral infection. Mastitis typically presents with symptoms such as back pain and headache. This statement is incorrect. The typical symptoms of mastitis include breast pain, swelling, redness, and elevated temperature, not back pain and headache. Mastitis occurs exclusively in women who have recently given birth. This statement is incorrect. While mastitis commonly occurs during the breastfeeding period, it can also develop in women post-menopause. Mastitis commonly manifests as a rash on the abdomen. This statement is incorrect. Mastitis typically manifests with symptoms localized to the breast, such as breast pain, swelling, redness, and elevated temperature, not as a rash on the abdomen. That will do it all for the content today, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, this is FixerMed signing off, and be sure to leave a like and potentially subscribe to the channel if you enjoy this type of content. But that's all I have for today, so goodbye and good luck studying, guys.